prosopagnosia is a disorder called prosopagnosia. Prosopagnosia is agnosia specifically for the recognition of faces. And there are patients whose sole difficulty in recognizing objects visually involves difficulty with face recognition. When these patients are discovered, what you always discover is damage in the parietal lobe of the right hemisphere. There is an area in the parietal lobe of the right hemisphere that plays a critically important role in face recognition. As you might imagine, suffering from prosopagnosia produces very distressing symptoms for the individual. It has a tremendous impact on your social life, for example, because you don't recognize people, even people that you know very well. You, again, may be able to describe what the person looks like, but you just don't know who the person is just by looking at the individual. So, for example, if I suffered damage, unfortunately, in the right parietal lobe and experienced prosopagnosia quite severely, I might go home and I'd see somebody there, and I'd know it's a woman, and I know that at the top of her body, that's her face. Although there are patients who are so severely disordered with prosopagnosia that they have trouble even telling what a face is, but that's unusual. Most patients know what a face is, and they can describe the face, they just don't know who it is. So I may look at this woman and go, well, all right, she's in my house, she's got long brown hair, she's smiling at me, I hope it's my wife, I'll take a chance, I'll go give her a kiss. But I wouldn't know just by looking at her. But when she talks to me, I would know who she is. What's very, if you're wondering, there's a question that probably is in some of your minds already. What about when people who suffer from severe prosopagnosia look in the mirror? If their prosopagnosia is quite severe, they look in the mirror, and what they see is an unfamiliar face. And that can be very, very distressing. So you sort of go, well, it's a mirror, and when I go like this, the face in the mirror is going like that, and I stick out my tongue and the face sticks out its tongue, so I bet that's me. You can sort of learn. What you can do is learn to recognize a small number of people by memorizing facial features. So you could memorize, okay, I've got a graying beard, darker hair, I wear glasses, so, whatever, however you describe my face in other ways. Okay, if I look at a picture of somebody with those features, maybe it's me. But what people with prosopagnosia don't have is the ability to just look at a face as a whole and have that immediate sense of recognition. The point I've been emphasizing now is that normal face recognition does not depend upon memorizing facial features. What we recognize is the whole overall pattern of those features. It isn't that you know what somebody's eyes look like. It's that you know how somebody's eyes look like in the context of their forehead, and how their forehead looks in the context of their eyes and their hair, and how their nose looks, not just a nose separate from everything else, but in the context of their eyes and their mouth. And small changes, not in the features, but in the relationship between features on somebody's face, can make somebody look very, very different. So normal face recognition depends not on feature recognition per se, but on pattern recognition. And it's that patients with prosopagnosia can't do in the case of faces. Often they actually have difficulty with other kinds of visual patterns, though sometimes they're much, much worse with faces than with anything else. And we do believe that there are areas of the brain that are dedicated not just to pattern perception, but really to analyzing the kinds of patterns that are involved in face recognition, because this is so important for our survival.